Well, we all know and we hear often one of the most important parts of a relationship is, of course, communication. And that communication includes more than just talking. Dr. Bill Baker is joining us now to talk about the importance of listening. And this is one of those things we hear all the time in relationships. Are you listening to me? It's difficult because sometimes you realize that maybe you're more eager to talk than you are to listen.
Well, you're exactly right. Listening is such a vital part of the communication process. Here's the bottom line. A healthy relationship requires good communication. That is a healthy or a balanced combination of self-disclosure and listening. Now, to fail at listening is really to fail at the relationship. And the focus of listening is increased understanding, which allows the relationship to grow. Now, there's a formula that is real simple. I brought I guess a grade report for the Communication Listening 101, and basically we need to get an A+. So to do that, we need 3 A's. And 1A is attitude. That is having the right attitude, a desire to communicate effectively, so we can strengthen and safeguard the relationship. The second A is ability, having specific listening skills, and the third A is action, putting those skills into action on a consistent daily basis. Then we get an A+ in communication.
Let's talk about that first A when you talked about attitude, because I imagine that's particularly difficult between men and women, especially if you're in the middle of an argument, to step back and to say, all right, let me put myself in the proper frame of mind to actually hear what this person is saying instead of being so angry that I want to speak.
That is a very tough situation because all of us want to get our message across, but the goal of listening, first of all, is to understand the other person. Now, to do that, there are at least 3 things I can do. I can paraphrase your message, that tell you back what I heard you say, so you can either confirm it or clarify it. I can perceive the meaning. For example, I notice a behavior that you do. You roll your eyes, or you look away, or you clench your fist. I point out the behavior in a neutral way and ask you to explain, well, what does that mean exactly? I perceive the meaning rather than guessing or assuming. And then I pursue the material to get you to talk more or self-disclose more fully. I ask you open-ended, creative questions to encourage more material to come forth.
But in each of these, you're approaching it in a non-threatening way.
As much as possible, because if you get defensive, you're going to either withdraw in silence or you're going to fight back, and that frustrates the communication process. So I have to create a very safe communication climate in which self-disclosure and listening will in fact take place.
And just in about 20 seconds or so, if you can tell me, what happens though when we pull back too much, when we're listening too much and not disclosing enough?
Then there is an imbalance and the other person will feel frustrated. Now, we can self-disclose, shall we say, too much too soon, but the opposite is too little too late. So each couple has to determine the amount of self-disclosure they need for the health in their particular relationship.
Important tips, like you said, for the health of a relationship, having both the listening and the talking skills and knowing when to do each one. Dr. Baker, thank you.
Thank you. Glad to be back.
We appreciate you being here.
Thank you.